Despite vaccinations being up and COVID cases being down, Minnesotans still haven't caught up on their cancer screenings. Data shows screenings are down by 20%, and that's a number that weighs heavily on Mike Koroscik's mind. He is the Oncology Operations Manager at Allina Health and a cancer survivor himself. I spoke to him tonight about how early detection saves lives. Mike, thank you so much for being here.
Thank you. I'm totally honored to talk on this subject tonight.
Yeah. Screenings are so important. We know that they fell by the wayside a little bit, almost out of necessity during the pandemic. Talk about where things stand right now when it comes to preventative cancer screenings.
Yeah, we saw a major dip during the peak of the pandemic, with many screenings dropping to nearly zero due to people just avoiding healthcare facilities and repositioning for COVID-19. But then we ended 2020, for example, in mammography, over 27,000 behind 2019. And so right now it is a prerogative, an imperative for the Allina Health Cancer Institute that we address the backlog of these early cancer screenings to catch up and, of course, catch cancer at its earliest, most treatable stages.
Mm-hmm. How does that practically work scheduling-wise? I'm sure it's probably going to be a busy stretch here if you are working through this backlog in addition to regular screenings.
It is. It's not only getting to our valued patients on, this is the time, this is the screening. In fact, the U.S. Preventative Health Task Force recently opened up screening guidelines for mammography and lung nodule screening. So we're reminding patients of that too. We're opening up our appointment book at Allina Health too, and making sure we're addressing this backlog as we saw the detrimental effects of catching cancer at later stages, which will have significant long-lasting impact on cancer care.
Mm-hmm. Are we seeing a bit of that? Do you think that lapse in maybe a year and a half, is that showing up now, I guess, in your offices?
It definitely is. Nationally, and with national data, and locally, we are seeing patients at later and oftentimes more difficult treatable stages in their cancer due to missing these screenings, or just not visiting a physician or healthcare provider this past year.
Let's talk about your personal story, because you're actually a cancer survivor yourself, and early detection was sounds like a big role in making yours treatable.
It's huge. Melanoma, which is actually one of our fastest growing cancer types in Minnesota, is also very personal to me, as back in 2007, in my 30s, a mole in my back that I couldn't see. It took my wife to actually see it and say, something is weird. You need to go see a dermatologist.
Can we quantify the risks of skipping even a year, or people who still are putting it off, not getting around to it? Even putting off a year can make a big difference.
Even 1 year could mean, in cancer, there's various stages of disease. And of course, we want to catch it at its most earliest, most treatable stages. But for example, lung cancer, which is one of our, unfortunately, most deadliest forms of cancer, a year later truly is the difference oftentimes between a healthy and a not healthy outcome.
Remind us of which screenings people really need to catch up on right now. So we talked about mammograms, but maybe run through some to just refresh our memory of what we might need to get caught up on.
Of course, I mentioned early skin cancer screening, colonoscopies for colon cancer. If it's also lung nodule screening, if you have a smoking background or secondhand smoke, and other genetic and hereditary factors too for early cancer screening.
You also talked about the age ranges, or the recommended age when you should start getting some of these screenings is in flux, and sometimes it's trending younger, so people should stay up to date on that as well.
Definitely. Breast cancer or mammography screening has been lowered this past year too. Lung nodule screening and the use of low-dose CT also age group has lowered. The goal is to truly to open it up to greater population. Also, it's also exacerbated the inequalities we've seen in cancer, to the fact that screening backlog has amplified healthcare disparities. You know, for example, 40% of higher breast cancer mortality rates are among Black women. So skipping preventative screenings only exacerbates that inequality, including that of non-English speakers and low-income groups.
What is the best way for people to make an appointment for screenings?
Please contact your doctor right away. Book an appointment online with your provider. At Allina, easy, allinahealthcare.org, and choose our preferred location. If you're worried about your health or stressed about weighing this on your to-do list, you're going to feel amazing when you get this done.
Mike, thank you so much.
Thank you so much.
Important reminder, you'll find more on cancer screenings and care at Allina Health at WCCO.com. We'll be right back.